And now to the very latest on COVID-19 here in our community. Joining us with his insight, Singing River Health System's Dr. Jason Williams, a cardiothoracic surgeon. Dr. Williams, so good to have you with us. Well, there's no doubt the pace of vaccinations has definitely slowed down in recent weeks, supply far exceeding demand. What would you say to people who are hesitant to get vaccinated at this point?
Well, the first thing I would say is that I've had a vaccine and I haven't grown a third arm, so I think we're okay there. They're safe. They are also effective, and we have pretty good data nationally to support those claims. The beauty of living in America is it's a free country. We can do whatever we feel is most appropriate for ourselves and our health care. But from a medical standpoint, I would say it is a very safe and effective way to prevent the disease, not only in yourself, but also the spread of the disease in our community, and to keep all of us safe.
Well, definitely the most vulnerable initially rushed out and were vaccinated. What we're seeing now is a little reluctance, maybe people in their 20s. Are you seeing any adolescents and teens through the Singing River system who are actually getting vaccinated right now?
We are. As a matter of fact, my children are among them, and that's because I think it's important. But you're right. I think that we do have a little bit of a lull in people coming out to get vaccinated. And there's probably multiple reasons for that, not the least of which is that people are out for summer vacation and their minds are on other things, such as going to the beach and having a good time away from school. One thing I would say with regards to the kids that you bring up is when we get back into school in the fall, one of the unfortunate side effects of COVID is that whenever kids are exposed to someone with COVID, either at home, in the community, or at school, they have to quarantine. And that's still a policy within our school districts here. And that leaves them vulnerable to education delays. And if we can vaccinate our youth, they won't have to be quarantined every time they come into contact with somebody who has the virus. And I think that that's not only going to help them from a health perspective, but I think also from an educational perspective and a mental health perspective.
And Dr. Williams, before we run out of time, I know you want to talk about this. During the pandemic, people really put off taking care of themselves in regard to other things. And you've actually, seen a little bit of an uptick when it comes to cardiac cases here on the coast?
We have recently, and one of the things that we're doing is trying to get people back to the doctor, back to getting their healthy exams again, their annual physicals, the cardiac evaluations that we offer quarterly here, where we'll evaluate for cardiovascular disease and get you in with a provider who can help treat that disease as quickly as possible if you're found to have it. And those things are all important, as are basic screenings like colonoscopies, mammograms, pap smears. All of those things are very important, and we want to get the community back into healthcare in the medical field so that we can keep the coast strong and healthy.
And I know, as a matter of fact, you have a Safe Heart Cardiac health screening event coming up Thursday, June 10th at Singing River. Thank you, Dr. Williams, for being with us today, okay? We appreciate it.
Yes, sir. Thank you.